Josh Marshall. So tonight we're going to meet the author of this book, Jonathan Cohn. It's called Sick, and it's an indictment of the U.S. healthcare system, or particularly the U.S. healthcare insurance system. As you can see, we're in a New York City cab right now, so we may actually be in need of healthcare assistance very soon. So here we are at the Strand bookstore, which is officially a gigantic bookstore. It's got something like 20 million miles of bookcases. We have Jonathan Cohn right here, who's an old friend of mine, former editor at the American Prospect, currently still an editor at the New Republic.
I am.
And long time healthcare journalist. Been writing about this for a decade, right?
Close to it.
Okay, something like that.
This is a book about the state of healthcare in the United States through the lives of a few people who have been affected by it. And I think if you have to take away one message from it, is that this could be you. These are stories about people who, for various reasons, ended up in a situation where they needed medical care and couldn't afford it.
Right.
And we follow their stories. And along the way of following their stories, I kind of string through a history of American medical care. I think it's about one part narrative journalism, and I think that's just from listening to readers. That's the part I think people identify with. You know, these stories. I really tried hard to kind of get people to jump into people's lives. So there's a lot of detail. These aren't just snapshots. 1/3 history. There's a lot of history in this book. A lot of it I stand on the shoulders of some very tall people who've written history before me, and I sort of synthesize what they've come through. And then about 1/3 policy analysis.
What's the 90-second history
of
U.S.
history
healthcare?
Is that basically, until the 1920s, medical care really wasn't that good, so it was cheap. But you know, it wasn't that good. So eventually they developed these innovations. You know, they learned how not to give you an infection when they did surgery. They learned how to dull the pain so they could give you surgery. But then once medical care got good, it got very expensive, and we began this long debate that we're still having about how we help people pay for it. And we kind of hit a fork in the road, and most other countries eventually went down the path of universal coverage. We never have.
If you were dictator of this country, what's your policy prescription?
I mean, if I were starting from scratch, you know, if I had a blank slate, I would try to invent a single-payer system. I think that on paper it works very well. And
people know that as a catchphrase. What does that mean?
It basically means that all the financing of medical care goes through the government or some entity that's controlled by the government, and you don't have private insurance companies competing with each other for business in the way they do now. Okay. So there's no competition to insure the least healthy people, which is really the engine that drives our whole system. I argue is driving it apart.
So insuring the healthy and the young,
right? And trying desperately to avoid insuring the sick and the poor.
Right. Let me ask you one other question. Yeah. When people say single payer, how does that is Medicare for senior citizens? Is that single payer? Do we already have like single payer?
Yes, and that's the thing. You know, it's a
people?
Terrible phrase, and somebody soon. I'm not that clever, but somebody will come up with a better phrase for it. The people in this country who have pushed Medicare have often talked about universal health care. Have often called it Medicare for all, which is a nice catchphrase, and that's really what it is.
There's just been an agreed-upon silence for the last 10 years because of what happened in 1993, 1994.
Yeah, I call it Clintonitis.
Right, exactly. It's just kind of like, it's terrible, but that's how it is.
Yeah.
What is, setting aside the policy issues, what's your diagnosis of the political question? Is it time? Is it time to go at it again?
I mean, of course, the great irony of the Clinton plan was they were desperate to avoid having a single payer plan, so they came up with this very complicated mechanism, which certainly had its virtues. I think the politics, you can make a case that we're closer than we were in the early 90s. The situation has gotten worse. I think you see more frustration on the part of business to get something done. Just they're tired of paying these employees.
Now, I think that globalization is also, I mean, that they're having to compete. I mean, GM in the United States has to compete against all these other countries where the companies don't have to deal with healthcare as a part of their business expenses.
Absolutely, and of course here in this country you have companies competing with companies from this country. I mean, that's the classic case. The grocery stores now, you have a lot of the grocery stores want universal health care because they're being tested by Walmart, which basically gets a competitive advantage because Walmart's benefits are lower.
Right.
So that is increasing the
so that across the board, there's everything's a race to the bottom, whether it's the quality of care, or race to the top in terms of premiums, etc.
Well, it's a very simple thing. I mean, you know, the market is really good at helping companies to maximize profit, and in the business of health, you maximize profit not by taking really good care of sick people. It turns out that you can cover everybody. You can do it for less money than we do now, and you can have a system that doesn't have long waits and has very good care. Some of the European countries are like that. The ones I.
You were saying France was sort of
France is like that. Germany is like that.
Yeah.
And, you know, every country has its strengths and weaknesses. I wouldn't try to copy their system. I don't know that you could, but in general, I mean, it's a myth that if you have universal health care, then you'll have to wait.
Is there any country who's had a universal health care plan and has gone back
No.
private healthcare insurance?
No. And if you know, one of the great things, if you go back to 1994, this is
Right.
393, there's a very famous turning point in that debate when Bill Kristol sent out a memo to Republicans, and this is the famous,
no
you know,
healthcare
the sight
crisis.
unseen. You know, do not compromise the Democrats. Reject any universal health care plan, sight unseen. And what's wonderfully revealing about the document, he was completely honest and said, we cannot let this happen because if the Democrats get universal health care, not only will they get political gains from it, but we'll never get rid of it. And of course, that's true.
Right.
And they know that's
Right.
true of all entitlement programs. And look, you know from Social Security,
Right.
you know,
Right.
They tried, very hard, and I think they came closer than some people realized. It
Right.
took a lot of effort to keep them from
Right.
doing that. But once people get these programs, they like them, and,
Right.
and particularly, again, they work. Medicare works. I mean, Medicare has its flaws, but it's the
Right.
most popular insurance program in the United States right now. And
Right.
to argue that we can't do that here, it just flies in the face of reality.
Right. So listen, go out, pick it up, and read it. It's an important book. Sick by Jonathan Cohn.
Cool. Thank you. That was very nice.